primary care docs or traditional healthcare providers, they're looking to see, are there any sort of symptoms or red flags that we need to reactively address? But what you're talking about is expanding the scope and looking for sort of indicators, right?
We are trying to find early indicators of a problem. Lagging indicators is the term you use. I love that for traditional medicine. When they find a problem, it's very late in the process. Well, we're looking at hormones, for example. Your doctor's going to look at, for men, total testosterone, and there's this ridiculous wide range, which is nothing more than the average of the population, which is half what it was 20 years ago, by the way. They're going to tell you you're, quote, normal because you fall into this ridiculous average of the population. But in fact, it's the wrong marker because free testosterone is the active form of testosterone, and total doesn't tell you the whole story. Free testosterone that most doctors don't even look at is a much better indicator. You could have total testosterone that may be okay, but your free may be very low. That's an indicator that there's a problem. When you have low testosterone, now it's impossible to build muscle. It's impossible to burn fat. It affects brain function. It affects memory, focus, concentration, mood, energy, metabolism, bone health, and also it puts you at risk of cardiovascular disease as well. So a lot of problems. It's not just about sex and muscle. When we go through medical school, it's diagnosis, and this is the drug to use to treat it. But we're talking about early dysfunction, and that's a very different story, and that's what's going to affect the things we care about: energy, focus, drive, resilience, strength, body composition, sex, and ultimately longevity.